Eds, we are live once again. So glad to have you here. We did have a produced video that came out yesterday afternoon that you all got to see and comment on, and we're going to talk about the subject that's in the title about the opioid epidemic in the United States. We'll get to that in a little bit. Before we start on that, though, I'm going to say hello to Hope Rexford, who's saying hi. I'm going to say hello to Shell Gamer. Hey, it'll be about 2 minutes into the video when we really start getting into the topic of the opioid epidemic. For the next minute and a half, though, I'm going to be greeting people as they come in, like Sheriff Gamer. How are you? I'm doing well. How about you? Really glad to be able to share this time with you guys and to talk about medical subjects as we do on occasion, a couple times a week, live like this in the evenings. A little bit earlier this week than we usually do, and late last week. We don't usually do it quite so early, usually a few hours later. That's because of some changes in my family's schedule this week. We'll be back to later, and usually, you know, on Thursday nights we try to hit one of these like around 7, 8 o'clock Pacific, sometimes a little bit later. So we really appreciate you guys being flexible on that. Kaylin's, finally I've made a live video. Yes, Kaylin, we are so glad to have you on this live video, and you'll be able to interact with us and talk with us as we get going. We're not quite seeing the numbers we normally do yet because it's kind of an off time, but BooBoo Kitty's here. Okay, good, BooBoo, you're here. Joanne Bowes from Durham, England. Wow, that's cool. We have somebody from England already. Laura E. Hi, Doc. Greetings from San Diego. And Hope Rexford. Hi, I'm from Pennsylvania. Good. Okay, so we have about another 30 seconds before we jump into the topic of the opioid prescription epidemic. There actually is a link in the description of this video. I think you can access it during the live video portion if you want to go over the Wall Street Journal website and see what the article is about, although it's probably hard to read it while we're talking about it. But of course, people watching this after the fact will be able to go to the link in today's Wall Street Journal and see that. Linda, what are you saying there? You're saying, Pinellas Park, yes. Trinity, hey, from Halifax, Nova Scotia. Yes, Trinity, we know that you're from Nova Scotia, and we appreciate you calling in or typing in. Dua A, Terra Apps, Butte, Montana. Excellent, Butte, Montana also. And if you guys need to get through, need to get attention with what you're saying, please do hit the little $ to use the super chat. That'll get you notice if we are in the topic and I'm not responding to the chat, as happens sometimes when we get going and I get on a roll. You guys know how it is. You've been here before. Most of you have. If not, welcome, and we are so glad you're here. And again, if you're catching this after the fact and you're watching this after it's recorded, wondering, how do I watch them live? I'm going to insert some information into the description later. It's not there automatically when we start. BooBoo Kitty, yes, you're right. We always want to have the super chat available for people. And Linda Watson from Florida. Okay, so it's been a couple minutes, so we will jump into the subject of the article. Sorry, every time I hit my hands here, it makes it shake. The Wall Street Journal had an article that just came out this afternoon on their website, and it was about a reduction in opioid prescriptions. Woohoo! Yay! Everybody's cheering. I see that you guys are there. Lots of thumbs up and likes for that. This is between 2013 and 2015, the CDC reported this data that the numbers have gone down approximately 13%. This is a first since 1999 when things were starting to really get bad. We have so many people on these opioids, and it's clear. And, you know, the CDC has actually come out and made a statement that it is not, opioids are not effective for chronic pain. People are still taking them when they have chronic pain, but they are not helping them. They're in no better place with them than they are without them. And Sandra Gore McCracken is from North Carolina. Thank you for coming in also. So we'll go ahead and open it up to dialogue here. If any of you guys have read the article, please do comment on what you read in it. If not, we can go ahead and talk about it. This is an ongoing topic. We've had other videos we talk about this. Obviously we have, because we know that YouTube marks anything where we use the name of an opioid as a non-advertiser friendly video, and it gets dinged on me. But that's okay. It's important information that needs to be talked about. Lowe's brokers, have you ever cracked anyone's back? Let's move on to staying on topic here. And I will, of course, respond to super chats. But other than that, we'll try to stay talking about the, well, I guess have I ever cracked someone's back, I believe was the question. No. Talking about back pain and chiropractic, I'll be very brief because my statement on it is rather short, and that is, it's good for acute low back pain, bad for other things. In fact, so bad that with chiropractic action on the neck, the literature is clear that if people go to a chiropractor to have work done on their neck, they're more likely to come out worse than better. Lowe's Brewery, sorry, from the Netherlands here. No, don't be sorry. We're glad to have the Netherlands joining in here. So that's my summary on that. Do A, if they say that opiates don't help, what are they supposed to use for chronic pain? That's a good question. And another part of the question is, what is chronic pain? Is it that there's some kind of injury or inflammation in the tissue that needs to be treated? If so, anti-inflammatories. If it's a nerve injury, then nerve medicines. If it's a psychological issue, getting the psychological issues addressed. And of course, chronic pain should always be treated, or at least, I'm sorry, I shouldn't say things like that. Consideration should be given to using a type of antidepressant, especially something like Cymbalta, which works very well for that. BooBoo's chiming in here. Suboxone is prescribed by only 4 doctors. Suboxone, yeah, it's gone. Say bye to your Suboxone. That's news that just came through through my local county health department today. But even though the prescribers are few, the abusers of Suboxone are many. It's cheap, plentiful, cheaper than heroin, easier to get. Yeah, that's a thing of the past. T. Lung, hi doctor. Hey T. Lung. Linda Watson, I've been on opiates for years from the VA. 3 shoulder repairs. Trinity, I have serious issue with the decline. I'm a chronic pain sufferer. I can tell you with certainty that it helps my pain. I'm on a very low dose, and I'm sick of being looked at like 1/2. BooBoo Kitty, thank God for that. Dr. Vaughan, Dana Vargas. That is true. They don't help as much as they used to because the people who take them without a prescription make it harder for us who really need it and take the right way. Trinity, addicted because I need help. Joanne Bowes, there are no painkillers that work on chronic pain. It's all of using your body as a tool, swimming or just aquatherapy. Yes, physical therapy, aquatherapy, we recommend people get into that. Yeah, I have lots of people who say things about I need the drugs, it helps. But in studies on people with placebos, we find that the opiates are not helping the pain. There's something else going on. A lot of it's psychological. Inflammation can be treated with anti-inflammatories. We know this. We know. The people that are out there that are on these medicines saying they're in chronic pain, where were they before we had these drugs? They weren't. I mean, there were people who hurt, but we've created these people with these medicines with something called opioid-induced hyperalgesia, where the opioid itself makes them feel hurting. So they are not helpful. And I'm not saying you're not hurting, but I am saying that using opiates to treat it chronically does not help the problem. Do A, amen, Dana Vargas, and on to, I can't say, is it Aaron? Touche? Or, yeah, Touche. Love your live videos. Well, we like to have you here too. Or I live your videos. We'll take that to mean I love your live videos. That'll work just as well. You guys are welcome to keep commenting here. That's really the full sum of what I had to say based on the article and the information that was in it. There's a little more information. I don't remember the numbers as far. That's all it is. It's just more statistics. But I kind of gave you the summary of it. Linda Watson tried physical therapy, TENS unit, and other therapies. Dorothy Gadsden. If you take it the right way, I don't agree with what you're saying. That's fine. You don't have to agree with what I'm saying. Don't agree with what you're saying, and that's speaking from experience. Yes, I'm also speaking from experience too. Experience of studies on thousands of subjects with placebo controls where they didn't know whether they're getting the medicine or not, and we find out what the deal really is. And an individual having an anecdotal account is a personal experience, and I cannot discount a person's personal experience, but I can tell you what it seems to be going on when we do study large groups of people. And that's what I'm here for, to tell you guys what the studies with large groups of people seem to be showing, and that is that these medicines don't help long-term pain. If anything, they make the problem worse, make people more dependent on the pain medicine. And that's obvious by the way that the numbers of prescriptions have just skyrocketed and grown. And for people who are hurting, we need to get them on this correct types of antidepressants, get them in the physical therapy. If they can take anti-inflammatories, not everybody can. If they can take the nerve pain medicines, we need to do that. Touche, I love your videos. Thank you, appreciate that. And I'm okay with, if people disagree. I'm even okay if people choose not to continue to watch because of that. I guess I'd understand. If I was in your shoes, I'd probably not want to. I stopped using pain meds and do acupuncture. Yes, acupuncture. I encourage people to try that. Barbara lies. My 86-year-old mom went from 2 OxyContin and 2 to 3 Percocet a day to 2 Percocet daily. She has almost no pain. She was abusing her opiates. Nando rocks. They can help to a certain degree once you get attached to them and need more. enjoy the high, it's time to get off. Well, absolutely, if it gets to that point. And I do not accuse people who are dependent on them of doing it to get the high, although some do, and obviously they're abusers. There's people who are doing it otherwise. So have GPs created a monster over the years, and how are they now going to get them off them if they're addicted? That's a tricky subject there. Thankfully, in our practice, we have very few patients who we have on chronic, just a handful of them, and we're tapering them off, thankfully. Requiem, is death symptom of a disease, or is it effective disease symptoms? Rodney McFadden. Yeah, I pronounced it right. My doctor's got me addicted by upping the dose. Now I want to be able to lower the dose. What kind of help do you suggest? Treatment center. I suggest doing a Google for your area for opioid treatment and recovery to get through that, preferably a medicated program that's overseen by medical supervision, a doctor somewhere in there that's watching what's going on. BooBoo Kitty, people I know are using Suboxone aren't in pain. That's concerning. Aaron Touche, I have chronic pain. Opiates don't work all the time. Get away from the opiates. Find other things that work. Acupuncture, aquatherapy, physical therapy, seeing a counselor, antidepressants, certain types. Nandorox, I've had over 11 surgeries for cancer and injuries. Left hand is paralyzed on Butan's patch, and my doctor and I are weaning myself off now. Okay, good. Patch is a nice way to try to wean off. Barbara Lies, never had pain until I experienced cervical radiculopathy 2 years ago. Took Vicodin for a couple of months and haven't taken narcotics since. Good, Barbara. Linda Watson, I have several injuries, military, lots of pain. Taking responsibility, tried acupuncture too. The VA won't do any more for me. BooBoo Kitty Drug Rehab has programs for people addicted to opioids. And sometimes they're expensive, BooBoo. Kind of frustrating for people trying to pay for them. Donia Ecker, I am not able to have knee replacements that I need because I'm allergic to the metals that are used. I do take fairly low dose of tramadol, as well as nerve meds for peripheral neuropathy. There's a lot of people in your shoes. You are not alone, Donia. His sibling, been on MS Contin for 25 plus years. Have been on higher and lower doses depending on the pain. Will likely be on low dose for me for the rest of my life. If you have a doctor who will continue to prescribe them, that may be a concern. Flu Hobby 2012, Doc, what is the way to prevent addiction of pornography, which not related to heroin or amphetamines? Paula Barber, don't agree either. I've been on the same dosage for 3 years. Please share a link that has long-term data for the study. I have ICS, have done physical therapy, yoga, etc. Donia Ecker, I feel a bit concerned as there's nothing else I can do. BooBoo Kitty, yes, they are expensive. Yes, they are. Absolutely. Yes, the people who are taking the opiates, you guys want to be trying to find a way out. Start thinking about it now if you're not already. If you've just been going along, feeling that things are pretty good and stable, I'm able to take this dose, that may not always be there. Be working on an alternative right now. Be forming a plan. Be talking to your doctor who is prescribing it about, hey, what's going to happen down the road to me? What do you see happening in our doctor-patient relationship in regards to this medicine? And Touche, so I got off the opioids. I'm better now. Excellent. Congratulations. Good for you. Now than I was ever getting off the pain medicine. BooBoo, just beat it. I'd have to look back and remember the comments. Oh my goodness, BooBoo. You know that if it was anybody else, I'd put them in timeout for that. Bianca Dye. Hi, Bianca. Dua A, I suffer from chronic migraines, been on opiates for migraines? Opiates for migraines. Went off them for 3 months and was stuck in bed in the dark room with no noise. Very difficult being a single mom. Okay, Dua A, find somebody who has treatments for migraine and not opiates. Opiates are way down the list for treatments for migraine. There are a lot of things both for prevention and treatment of an acute migraine. Oh, also, abortion of a migraine as it's coming on with the triptans. So there are lots of medicines and options out there. I was able to attend a conference at USC on migraine. It was awesome. And I came away from, you can actually watch one of the videos where, did we do it once or twice on video, where we do the greater occipital nerve injection. The patient is pain-free instantly from a migraine that had been there for days. There's things like that that are available. Joanna Bowes in the UK, cannabinoid oil is a new big thing. Is that just a thing in the U.S.? It's everywhere. It's not new, and it's really not any bigger than anything else. Linda Watson, if I'm not in pain as much as I am, I would not take them. BooBoo Kitty, sorry, Dr. Vaughan, couldn't resist. I'm truly sorry. Barbara Lies, I listened to a great podcast about pain, now how Americans are intolerant of it, while in other countries, pain is tolerated much more. Barbara, you're right. In many ways, we are spoiled and told we should have not pain or not have pain, as the case may be. And yeah, there's a whole psychological component to it. You're right, Barbara. You're hitting on something there that we've touched very lightly here. Linda, the people abusing them are hurting people are hurting people like you. Something like that. Donia, I need knee replacements, but I'm allergic to all them. We've said that before. But on tramadol. Also Celebrex and cerebral neuropathy. And hopefully those are helping you get by. Bianca died when I have a migraine. I live in the dark with just as little noise as possible. Oh, it's miserable. And then paracetamol, for those of you who are in the United States, she's talking about the generic equivalent of Tylenol. And of course, for people who can take the medicines, we recommend that they try what is the name brand Excedrin. It's a combination of 1,000 milligrams of Tylenol, 650 milligrams of aspirin, or you could do 800 milligrams of ibuprofen and about 60 milligrams of caffeine. Now, not everybody can take that. You need to check with your doctor if you can take that, but that's one of the medicines that people will get pretty good effect for migraines from. Of course, when they don't, there's other things we move on to. Where's our office? Auburn, California. Nanya rocks. Do it. Try Botox. Yeah, Botox. Excellent treatment for prevention, for maintenance for people who have migraine. And, of course, BooBoo's helping me out by telling everybody that we're in Auburn, California. Bianca Dye, I haven't had a migraine for a while, thankfully. Taking 3 tramadol a day at minute for sciatica. I also take paracetamol. Just makes me so tired. I try not to take the tramadol. Dua A. How about cannabinoids? I've had all those. I get blocks about every 3 months. Anti-inflammatories. Can't take them. Have 2 bouts of Botox, but it didn't work. Okay, yeah. There's still more stuff. There's still more stuff out there, and stuff coming, by the way. The new biologic meds that they're hoping will be released next year. Kind of hopeful for those. One of the guys speaking at the talk, you have to be a little careful because he was actually a consultant to one of the companies that's making them. So I take it with a grain of salt what he says about them. But I think there is something to be looked at there with these biologics for migraine. Do you feel that tramadol is safe? No, not safe, but very helpful in many circumstances. Nanda rocks, doc, so you notice increased depression, anxiety with opioid use? Yeah, you see that. Absolutely, you see it. I see people's lives changed when they stop taking the opioid. I see their eyes look different than glazed over. I see their relationships with their spouses go back to normal when they stop taking opioids. I see good things happen when people stop taking opioids. Nanda rocks, it took me 3 Botox injections to help with them. Yes, it may take a while for it to take effect and to be effective and do a good job. Guys, I'm so excited. This is like more viewers than we normally have by 50%. So maybe earlier is better, but of course we can't do this normally because I'll be seeing patients earlier in the day in normal weeks. Touche, I like your earwax. Oh, thank you. I appreciate you saying that, and I appreciate you watching. Dr. Gilmore and Dr. Butler did Botox for patients' migraines. It was miraculous the way she felt after. I don't know how you get miraculous results immediately after Botox. I suppose you could if it works that quickly. I usually think of it in terms of a maintenance medication. Speaking of other doctors on YouTube, like Dr. Gilmore, Dr. John Gilmore, I encourage you guys, because I am a fan of some others also, like Dr. Paul Thomas. And lately I've really been enjoying SciShow. They do a lot of medical topics on there, and SciShow Psych. They had a good one that just came out today on whether fidget spinners, the things that kids play with, help for ADHD, and the answer was they don't. But I'm not going to give away a spoiler. Touche, I know about the topic, but that's what I wanted to say. BooBoo, love drugs, Dr. Vaughan. Linda, with me, more pain and depression gets worse and suicidal I get. That definitely is a situation that needs attention. If anyone's thinking of harming themselves, call the suicide helpline immediately and then follow up with your doctor, preferably with a psychiatrist if you're suicidal. Janigan, doctor, when I had a severe break in my arm, they gave me codeine. It didn't work at all. My mother says she's allergic, and I wonder if there's a relation. No, you don't inherit specific allergies. You can inherit tendency toward allergies, but not a specific allergy. You have to be exposed to something to be allergic to it. You can't be allergic to something you've never had in your body because you never had a chance to make an antibody to it. Bianca Dye, I don't always think the tramadol takes my pain away. Is it possible that it's not working for me? I guess it's possible. Sakura Chan, really, a fidget cube does wonders for my ADHD, especially in college. Yeah, there's absolutely no studies that have proven that. Of course, there's none that have proven that it doesn't. But go ahead and keep using it. A cube. You said a cube, a fidget cube. This was about the spinners. Yeah, one of the things that comes out in that SciShow Psych is that the complicated spinning device may not have the benefits of other fidget devices that have been found to help people with ADHD to focus. So yeah, you were talking about the cube. Okay, Linda's undercare. Good. Do A after my neurologist walked down the hall, throwing his hands up in the air. Said he didn't know what to do. I could get off the couch to do laundry. That's when I found my first pain doctor. Oh, I'm sorry for that experience. Hope you find somebody different than that. Bianca Dye, do I need something stronger or is something I just have to live with? You're going to have to work with your doctor on what the options are on that. Lita, 131. Lita's on my good list this week. And she has a fidget spinner. Yeah, they're fun for a little bit. Sakura Chan, oh, okay, the spinner works to a point, but it's more distracting for me to do the constantly having. That's the point. Yes, Sakura Chan, that's kind of, they don't come out and say that in that detail in the SciShow Psych episode that came out today, but that's behind it. Yeah, it's a different situation than just simply touching something. It's more complicated, and it actually takes some conscious work on it to keep it going. And you have to hit it in the right spot. You have to hold it the right way. Different from the stress balls or the cube or some of the other devices people have used for their fidgets, for their attention issues. Oh, Lita, you didn't have to do that. Thank you so much. No, don't. Stop. Don't stop. Don't stop. BooBoo Kitty, pencil and ruler were awesome fidget spinner. BooBoo, you always bring the old school things, and they're appropriate too. Give you a thumbs up. Okay, we'll take that. We'll take the likes too. I appreciate that also. Yay, Lita, Sakura. They were BooBoo. Lol. Okay, guys, thank you so much. I'm going to head out. We got a place to go for my mother-in-law's birthday. So everybody wish her happy birthday. Write in the comments, happy birthday, Carol. She'll appreciate that. She'll read them. I'll make her. Until next time, Dr. Mark Vaughan telling all of you to stay in good health.